All right, so we got Dr. Keynes on today. Dr. Keynes trained at Cornell, and then he went to Cleveland Clinic, and now he's at Lahey. And he does a ton of stuff, and we're going to have you back to talk about oncology and some of your stuff that you're doing there for oncology. But what we really want to talk to you today is about WellPrept. And the reason we want to talk about it is these are hard conversations to have with patients.
Yeah.
So tell us what happened, where are you, and what's going on?
Well, let's talk about what happened before WellPrept.
Yeah.
So, I do a lot of oncology, and let's talk about just prostate cancer new patient visit. There's so much to get through, starting from what is the prostate, and then what is cancer.
Right.
What's the difference between grading and staging? What is Gleason score? And oh, by the way, it's not Gleason score anymore, it's grade groups. And what does staging mean? And then eventually you get to the part about that patient. And that's the part that I used to really, really enjoy. But it was very frustrating to me that it was condensed into the back end of a visit. And all the rest of the time I felt was mostly wasted.
Right. And they don't listen once you start talking about cancer.
That's right. That's right. They're not in the comfort of their own home.
Yeah.
They're afraid. They're intimidated. And so, shared decision-making is a buzzword, but it frustrated me for many years that I thought I really never got towards real shared decision-making. So there's a concept of a flipped classroom where in school, students learn before they come in for the lecture, and they deepen their understanding while they're in the classroom. So I thought we could apply the flipped classroom model to the clinic.
Okay.
And there's no reason why patients can't get themselves up to speed on the basics at home. And so that's the genesis for WellPrept.
Okay.
Yeah.
So you learned this theory and you're like, I'm going to do it.
Well, it started off, I just wanted to sort of see if patients could get up to speed on their own. And I started sending the NCCN patient guide to patients just for prostate cancer.
How'd it go?
The visits were so much better.
Wow.
Okay. For me and for the patient. And it's not all about me, but we do have to be concerned that a doctor wants to stay doing this for 35 years. So,
Yeah.
Our well-being is paramount, but also for the patient. It doesn't work for every patient, but most patients are able to go through vetted materials and get themselves up to speed. So what happens then? What happens then is the patient comes in and you can deepen their understanding. You can start with their list of questions. And in prostate cancer, you can get to the parts like, let's review your MRI. Here you can see the cancer's bulging towards your nerve. That's why we're not going to do a nerve sparing on that side. Or maybe a complex active surveillance discussion where you really can talk about percent pattern 4 because the patient's coming in with a baseline understanding of the lingo, what you're talking about.
Right.
So my personal experience translated into WellPrept, but for me, really genuinely made me enjoy patient interactions and feel like I could maximize those fulfilling conversations that were deeply personal for the patient.
Was there any issues with misinformation and, in a way, like if you tell a patient, just Google prostate cancer, I've heard people say that.
Yeah.
It's usually doesn't end well.
That's exactly right. So if you leave patients to their own devices, and they will go to Google on their own, and it's the Wild Wild West.
Right.
They will not find reputable information. If they do, they may stumble on it by accident. So that's another one of the key principles with WellPrept, that we vet the information so that we actually scoured the open source web and put together a database of over 6,000 reputable pieces of information that serve as the foundation for WellPrept seed content, we call it. And then our users can adapt them with their own information, or if they want, their own videos.
So cool. And then you only ask for prostate cancer?
We do it for every condition in urology. We have the full spectrum of urology covered, from pediatrics, voiding dysfunction, transgender surgery, urethral reconstruction. I mean, there isn't a corner of urology that we haven't covered.
Wow. And since you started, what do you see in the patients before you started this, and what do you see now?
Well, I'll tell you direct anecdotes from our users.
Yeah.
There's a couple things. First and foremost, this has become a wellness tool. So our users are telling us they're enjoying clinic more because they feel like the provider, the doctors are having the types of conversations that they actually want to have with patients. Patients experience receiving these resources as a gift from the doctor. So patient satisfaction is up.
Right.
Patients are starting the visit by saying, "Thank you for sending me this information. None of my doctors ever do that. This is amazing."
Right. It's so simple, but also so now.
Yeah,
Right.
it's a simple concept. You know, patients are anxious. They are frightened. They often come to us with overwhelming diagnoses. They're hungry for information. They're going to look for it whether you help them out or not.
Right.
By having helped them, they are just eternally grateful.
Very cool.
Yeah.
And so you and fine, that's for the doctor. What about the patient?
So the patients are going to try to Google this anyway. They feel a sense of relief that they no longer have to. I'll give you some actual data.
Yeah.
We randomly survey patients when they arrive to WellPrept pages, and now we have over 5,500 survey responses.
Okay.
We ask them 3 key questions. The first is, are you more likely to recommend the doctor because they sent you these resources? 95% say yes.
Unbelievable. Okay.
Are you less stressed and anxious about your condition? 80% say yes. Do you feel like you have a better understanding of your condition? 96% say yes. So my feeling about this is what's more important than a happy patient? And that's why each of us decided to go into this profession
Sure.
as undergrads.
It's pretty cool.
Yeah.
Okay. And it's, in terms of, the idea is very good. You could have probably made a simple format, had it for your office, and you use it internal. Why
start a
Why
company?
take it to the next level? You're busy.
Yeah.
You're a busy surgeon.
Yeah, I'm busy. I'm a father of 5 wonderful boys. Yeah. This was a problem that wouldn't leave me alone.
Great.
In entrepreneurial circles, they say if a problem won't leave you alone, it's probably a good idea. This helped me so much with my own personal well-being, and doctors are hurting so badly right now. Any burnout statistic is usually in the neighborhood of 60%.
Yeah.
It started to feel, quite honestly, like an obligation on my part to try to spread it to help as many other doctors as I possibly could. My strong feeling now, and it's become a passion of mine, is that doctors are in the best position to discover and disseminate systemic improvements to our workflow. We are in the best position. We're living it. Nobody's coming to rescue us from the outside.
Right.
And so why did I do a crazy thing and start a company? It's because the idea wouldn't leave me alone.
So I met you when you had 0 users.
Yes.
You had absolutely 0 users. That was 5 years ago.
It was actually only 2 years ago.
2 years ago. Okay. And now?
So we have hundreds of users. We are signing up health systems, large academic groups, large private practice groups. It doesn't seem to matter what practice setting people are in. That's just in urology. Now we're starting to expand outside of urology as well.
Very cool. And in terms of next steps, are you done? Is illness?
No.
Okay.
So next steps are, I firmly believe that if we can establish a strong pipeline, WellPrept being a pipeline that delivers information to patients, that we can use patient education as an intervention to improve care. Let me just give you one example in oncology. Let's say we decided that the rates of radical prostatectomy in very low-risk prostate cancer are too high. Admirable in Sweden, less so in the U.S. If enough urologists use WellPrept, and that would make it so that most patients with a new prostate cancer diagnosis receive curated educational information. If we then decided, all right, let's focus on teaching patients about active surveillance, we might find that education as the intervention changes the metric that we want to change. That's my future goal.
Okay. And in that way, how will the system adjust? Will it stay the same?
Yeah, it's hard to predict. I don't think that patient education has been used enough
To even know.
But it's so logical. I know that really in any domain that we want, we can improve care just by involving the patient and educating them.
Is AI playing into this at all?
Yeah, so AI, we use AI behind the scenes. We're using it more and more, but we're using it thoughtfully. I don't want to shoehorn AI in where it's not needed, but just give you an example. Part of what we do is curate the best resources in the open source web. We have AI agents that help us do that, and then AI agents that help us update the content when new information becomes available. That's just one idea.
That's great.
But more globally speaking, I just want to say this is the first AUA where I really have a strong feeling that not just with WellPrept, but AI in general is really going to save us, save our profession. What do I mean by that? We all love the one-to-one interaction with patients. That's why we decided to do this in the first place. I'm seeing for the first time, whether it be AI scribes, downstream from that, AI is going to help prepare our orders that we mention in a visit. There's going to be a bubble around that patient interaction that protects it so that that can be our focus throughout the day. And so I think the outlook is very bright over the next 10 years. More of us are going to be recommending that undergrads pursue this profession, and the burnout rates are going to go down.
So cool.
Yeah.
All right. Well, thank you so much for speaking with us. It was awesome. I think this speaks for itself.
Thank you so much.